Disparities Task Force that we established in Oakland and Alameda County back in April, shortly after the absolute onslaught of this COVID-19 pandemic, not just here, but around the world. This task force was stood up to do two things: to immediately and rapidly respond, to try and do everything we could to reduce the disparities by race, by income, by worker class that we knew would happen from this disease. And secondly, to formulate a longer-term action plan, to think about how we can, through the social determinants of health, reduce the disparities and risk factors that continually, decade after decade, century after century, create unjust disparities in health outcomes based on race and income. And this group has been working so hard over this period of time. When we launched this task force in April, we committed to doing this intensive work as a unified community. Little did we know that at the end of our commitment, we would find ourselves in one of the most grim and pressing moments of this entire pandemic for the Bay Area, for California, and for the United States. But this work is not over. We are here tonight to present to you, the public, a draft set of findings and recommendations for action. And we want to invite you to ask your questions, to give your suggestions, to share your input so that it will inform the final product as we continue this critical work. And so I want to give just a quick update on our work. If you could put up my slides. This is our third and final public hearing for the task force. That was our commitment when we launched in April, and this is our third and final public hearing. But do not fear, we know the work is not done, and we will be talking a little bit later about how this work will be passed on to the Oakland Thrives Leadership Council. Next slide. As a reminder of our two goals, it was the immediate rapid response, and secondly, the longer term work. And we're excited to present to you both an overview of what we felt were the best practices in our rapid response and how those need to be accelerated and expanded, but also an action plan, a real call to everyone with advocacy for legislation and other longer term changes that we believe in the future could prevent the types of heartbreaking disparities, unjust disparities that we have seen and continue to see with regard to COVID-19. I will say that when we started this work, the disparities were stark. Double the death rate for our African American community, triple the infection rate for our Latinx community. At one point, it was 20 times the infection rate for our Latinx community compared to other racial groups in Oakland. Over the course of this pandemic and through the valiant actions of many of the task force members, their organizations that I'm going to introduce soon, that disparity has been reduced. And we believe that that is in part because of the not only the extra effort that everyone has put into this pandemic, but the very specific tools and strategies that this task force and its members came up with during the course of our work. Next slide. I want to thank my fellow co-chairs, and at the end, we will be wrapping up with their reflections as well as their commitments on the call to action and the next steps. Dr. Tony Eiton, just what a hero for me, the Vice President for Healthy Communities at the California Endowment, Alameda County Supervisor Wilma Chan, always a champion for health, and our own California Assembly member, Rob Bonta. And then the task force members, an incredible group, and I'm gonna name them not only because you probably know who most of them are, but the organizations that they represent. I cannot stress enough how blessed we are in Oakland to have these deeply respected community-based organizations that are delivering culturally competent healthcare. And if you could show the next slide with the photos of our task force members. Our Shiro Congresswoman Barbara Lee, Supervisor Keith Carson, Kwok, the Chief Deputy of Administration and Programs for the Asian Health Services, Councilwoman Lynette Gibson McElhaney, representing the West, School Board Director James Harris, representing the East, Councilmember Lauren Taylor in Central East Oakland, the CEO of PolicyLink, Michael McAfee, the Vice President of Public Affairs for Kaiser Permanente, the fabulous Yvette Radford, the Chief Administrative Officer of the Native American Health Clinic, Natalie Aguilera, and then, of course, Street Level Health Project, an incredible link to our day labor population and our Mayan mom population. I do not know what we would have done without you, Gabriela Galicia, the Executive Director of Street Level Health. And then, of course, Dr. Kim Rhodes from UCSF, the mastermind of our incredible health festivals at Imoja and Juntos Sandado in the Fruitvale. And then finally, of course, our beloved Jane Garcia of La Clínica de la Raza. What a rich treasure trove of incredible health geniuses and political leaders that we are blessed with in Oakland. Thank you so much, everyone, for the incredible work. And as we hear from our speakers tonight, I ask that our task force members who are participating tonight, as well as our amazing affiliates who also are in this fight with us, members of the frontline healers and other amazing community leaders, you can put your questions for our panelists and preventers in the chat. You can please put them in the chat, and based on how many there are, I may call on people personally, but just to make sure your place is held and to help move the program along, please put your questions in the chat. For our viewing audience, we're using a wonderful tool called Thought Exchange. Thought Exchange allows you, if you click the link that you're seeing right now, it allows you to post a question or a comment. While we may not get to every single comment that is posted tonight, they all will be preserved and incorporated as we work on the final draft of our recommendations and our call to action. So please be sure to post your questions and your comments in Thought Exchange. And if you want to vote or elevate other people's questions or comments, you can also vote on other people's questions or comments to express your support for them as well through Thought Exchange. Again, very easy, click. We also, throughout these presentations, will be posting links to a survey. We want to get your feedback, particularly when we get to the part of the program where we will be talking about our recommendations. So to just go over what we're going to be doing tonight, we are going to be first hearing updates from Alameda County Department of Public Health on the recent surge in COVID-19 cases, and particularly the threats for our ICU resources. I'm sure they will update us on the recent announcement that Governor Gavin Newsom made with further shutdowns in parts of our state, not Alameda County yet, but in parts of our state where the ICU capacity is severely threatened. They will also talk about plans for vaccine distribution and our strategy for ensuring that that vaccine distribution is equitable. We will also hear more from our community partners, a highlight of the lessons that we learned during the course of this task force's work, what we believe are the best practices going forward. And finally, our allies at Bay Area Regional Health Inequities Initiative, we call it BARHI, will present our draft action plan for discussion and your excellent comments and questions. This is supposed to be an action plan, not a report that sits on a shelf and gathers dust. So please hold us to that and make your contributions so we can be sure that this truly is a call to action. With that, I'm excited to turn it over to our Alameda County health officials to give us an update on the state of the pandemic. It is my pleasure, and how lucky are we to have these incredible professionals that have worked so hard, sacrificed so much. Dr. Kimmy Watkins-Tart and Dr. Nicholas Moss. Kimmy Watkins-Tart, please take it away.
Actually, I think that Dr. Moss is going to kick us off and start with a data update.
Thanks, Kimmy. Thank you, Mayor Schaaf, and my thanks to the co-chairs and also to the whole task force for its work and for allowing us to come and help contribute. And of course, I always want to thank our county residents for all the efforts that they've made to make things work and support each other through the pandemic. Next slide, please. So we will cover very briefly the state of our cases and hospitalizations, as well as deaths, and also the inequities by race and place that many of you are now familiar with. And just to briefly update you, and then I will comment on the state's action that we heard about today. Next slide, please. So overall, the news is unfortunately not very good. We have continued to see high numbers of cases reported through the month of November and into December, similar to what is seen around the region, around the state, and frankly across the country. Although the surge is relatively recent, I fear that we are going to continue to see some disparities in that data. When you look at things overall, of course, we have had a very disparate impact of COVID in Alameda County. I think it's too early to say what the surge will look like in the end, but I do fear that we will see those some of those disparities persist. Next slide. So these are our you can see these in these two curves, both the case rate per 100,000 residents in the county by week in the orange line, and in the blue line is the number of cases total reported per week. And we peaked originally, or not originally rather, but over the summer, the last big wave that we experienced peaked in July. I would disregard that little downturn at the very right end of the curve here. That's just from data that was not fully entered yet. This curve continues to go up. We've actually exceeded now our summer peak. So it's as widespread transmission of COVID as we've ever had going on right now in Alameda County. Next slide, please. So this shows you how the various actions we've taken have related to these waves. Way back in the beginning, shelter in place and face covering orders here and around the region were among the first implemented anywhere in the country. And we really avoided a big spike in cases at that time, while other jurisdictions around the country did see more severe spikes. And then when restrictions eased up, you'll remember that took us into our summer surge. In Alameda County, we paused for the reopenings and we expanded our contact tracing and our testing operations. and similar efforts to limit activities were undertaken across the state. We saw things come under control. We probably got some help from the smoke in the fall, and we began to reopen, and places around the region, around the state, around the country reopened. We moved slower here, but nonetheless, with that reopening, we have seen this more recent wave, and our last restrictions were implemented just about 2 weeks ago now, when we were moved by the state into the purple tier with the state's purple tier restrictions. Next slide, please. With the surge in cases, we are seeing a surge in hospitalizations and intensive care unit hospitalizations. We are not quite to our peak of the summer in terms of hospitalizations, but we are close, just about at 200 people hospitalized today for COVID. And we know that hospitalizations lag increases in cases, and I think this is going to continue to worsen. In the intensive care unit, we have plenty of runway left. We have plenty of beds available, but we have almost 60 people in the intensive care unit now. It was in the teens, almost down to the single digits at the low point. And so we've increased quite a bit over the last month or so, and all signs point to this continuing to increase, and we have not yet seen the impact of Thanksgiving and mixing of people over the holiday, which I think unfortunately is going to lead to further increases here. Next slide. This slide shows our rates of deaths and the absolute numbers of deaths. The rate is in orange, and our rate of death peaked in August, a little bit after our case peak in July, and that is to be expected in terms of the number of deaths per 100,000 residents per week that we observed. And things dropped considerably in the fall following our case rates. We have not yet seen large increases in deaths, but again, these will lag increases in cases. Although we do think that there is some improvement in care for the most severely ill persons. And so it is our hope that we see a smaller number of deaths overall. Also, the vast majority of our cases are in younger people, but nonetheless, we are seeing hospitalizations in high numbers. And when we see that, we do expect some deaths to follow, unfortunately. Next slide. I mentioned that we're in the purple tier, and we have been so for 2 weeks. And this is going to continue for the foreseeable future, and additional restrictions are anticipated. The state announced today that additional restrictions would be applied regionally to regions that had less than 15% of their intensive care unit beds available. The Bay Area is not at that threshold yet, but we are heading towards it very quickly. Some of our neighbors have exceeded that threshold. Action is going to be required one way or another to protect our healthcare systems and protect our residents. The restrictions that the state introduced today, when they kick in, they would essentially limit additional activities similar to what we have been seeing, not as much as we saw in March, but more than where we are today. And I invite people to look at the state's COVID website. It summarizes these changes. Again, not in effect in Alameda County today, although the purple tier restrictions remain in effect. Next slide. Testing, very important part of our response here in Alameda County, peaked over 9,000 tests total done per day leading into the Thanksgiving holiday. That's over 600 tests per 100,000 residents. Next slide, please. Test positivity, however, has also increased. That means there's just more virus out there circulating. When people test, the likelihood that they'll test positive has more than doubled in the last month. And that's reflected in our increasing test positivity. Next slide. I think I covered this already. This is really just our case rate. So we'll move on to the next slide. Moving on to the disparities that we observe in Alameda County and with COVID. And so what you're seeing on this slide is each column here represents 2 months of the pandemic, and you're seeing the distribution by percent of cases by race and ethnicity. And I will draw your attention to the light blue color. That is the proportion of our cases in our Latino residents, and it is where we have seen the vast majority of our cases throughout. Although the distribution has changed a little bit of time, that disparity has remained, and right up through November. And while some things have, some of the distribution of cases has changed a little bit, nonetheless, that community continues to be the most impacted. When you look at this data by rate, and I think we have that slide. Next slide, please. So when you compare the cumulative case rates by race and ethnicity, what you'll see is that really it is communities of color that are disproportionately impacted. And so the thing about expressing this as a rate is it allows us to compare the different communities. This is total number of cases throughout the pandemic in Alameda County. You can see the rates are highest among Latino residents, but really communities of color in general disproportionately impacted. Next slide. This slide really shows you that as case rates improved overall, our disparities shrank quite a bit. And really the question is, how much do they widen again with the current surge? Because we know some of the structural things that are in place that drive these disparities remain, even though, as the mayor said, a huge amount of effort has been put in to narrow this gap. And I think a lot of progress has been made to try to address these disparities, both in terms of access to services, support for workers, access to testing. But I am sort of holding my breath to see how things evolve over the next few weeks. Next slide, please. And then deaths is the other place where we've seen very striking disparities. So this is a similar slide, distribution of deaths by race, ethnicity. And what you'll see here is that, because due to the fact that the large number of cases were impacting our Latino communities, also a large number of deaths impacted our Latino communities, but also disproportionate numbers of deaths relative to the amount of cases impacting our Black residents. Next slide, please. And again, these are the rates, so you can compare. It's a good way to look at disparities, and you can see that the death rate for the overall population in Alameda County was highest among Black residents, and then followed by Latino residents. But striking that these communities of color with much higher rates than white and Asian residents, and as you may have heard me note in other discussions, we know that many communities are represented within these larger groups. We know that these categories don't really capture the texture of Alameda County and the differing impacts of COVID on communities within these larger groups. And so I acknowledge that is a limitation in our data and the way we share this data. Next slide, please. Just in terms of place, the I-880 corridor, where our most dense neighborhoods are, where the concentration of essential workers and people who have to work outside the home is highest, where people live in denser housing, and of course where many people are of communities of color, disproportionately impacted throughout this epidemic. Next slide, please. And in just zooming in on the zip codes, with the highest and lowest case rates in Oakland over time, you can see that it is 94621, 94603, 94601. These neighborhoods have really been disproportionately impacted within Oakland compared to the neighborhoods you can see with the lower case rates, Piedmont, Montclair, Grand Lake, Uptown, Emeryville area. And so absolutely different pandemic, a different epidemic in different neighborhoods. Next slide. Okay, now I'll turn it over to Kimmy here.
Thank you, Dr. Moss. We've been at this for over 8 months now, and a lot has happened in the 8 months, and we've made a lot of major strides in our response. And I just want to just start out by saying that none of this work could have been done without all of you. None of this work could have been done without having venues like this so that we could hear your comments, your questions. We could struggle with you. It has made our response much, much, much better. We would not be here where we are in terms of our system without your partnership. Next slide, please. As we've all mentioned several times in the past, that COVID really uncovered a lot of the things that we've known all along. That COVID uncovered the harms and risks that were faced and are still being faced by people in our community. For COVID, those harms and risks have landed disproportionately in the Latino and African American community. For the Latino residents, overcrowded households, essential work, and neighborhood poverty have really made a significant contribution to the higher rates. For African Americans, comorbid conditions, congregate living, and essential work have really increased or been connected with increased fatality or higher risk of fatality for African Americans. But there's one constant that's always there, always was there, and still there that we have to still work on, and that's institutional and structural racism. Next slide, please. Our response as a local health jurisdiction for Alameda County is countywide. However, we have made a concerted effort to really focus our work and enhance services in areas of the county where the impacts of COVID have been felt the greatest. And those neighborhoods, 3 of those neighborhoods are in Oakland, East Oakland, West Oakland, and the San Antonio Fruitvale area. Next slide, please. We've worked hard with many of you to make COVID-19 testing throughout our county available, and to especially expand testing in higher impacted areas. Partnership with community partners like many of you here, particularly trusted organizations in these areas, has been really critical to improving access. We currently have 15 community testing sites, stationary sites reach for 5,000 per week, utilization across multiple racial and ethnic. Next slide, please. More recently, we have established mobile testing sites so that we can bring testing to people where they normally come. We currently have more than 20 mobile testing sites across the county in high need areas. Those testing sites are testing up 4,000 per week. Next slide. This slide shows the efforts that we make locally in improving access. Those have been we have been improving our testing consistently from April through today. Next slide. To scale up and strengthen the county's case investigation and contact tracing capacity, partnership with CBOs has been critical to doing this. And I want to pause by really saying that it has, This has been a very new thing for all of us, and not just in Alameda County, across the nation. Case and contact investigation has not been a service that is often a part of a community-based effort. But having this community-based service has really helped us to address the need to expand rapidly, target resources to the most impacted areas, leverage trusted relationships with community partners and patient populations, bolster cultural and linguistic capacity, and strengthen our overall COVID response from testing through recovery. Here you see only a few of our community partners that provide the case and contact investigation and contact tracing. Next slide, please. We call it CICT, Case Investigation and Contact Tracing. Our CICT team model and continuum of care is illustrated here. Our operation includes nearly 100 CBO staff to date, including 76 case investigators and 22 team coordinators and resource navigators. Teams are highly collaborative and productive. As a case in point, during this past week, over 1,100 cases were. Next slide. We've known and we realize that isolation and quarantine is very, very, very difficult. It's especially hard on people and families who need to work and are unstably housed or homeless. In addition to the financial assistance through the county's Arch Stipend program, which to date has issued 1,337 stipends, which is roughly over $1.6 million. We also have offered isolation and quarantine care kits, food distribution and delivery, and isolation housing. Our food distribution programs offer 2 to 4 weeks of food during isolation and quarantine periods, serving over 200 households each month. For isolation housing, we currently have 9 hotel sites countywide, including 3 in Oakland, 3 trailer sites, and multiple scatter sites. Next slide. Having a network of community providers has been really critical to our operation and our response. Here are a few more of our community partners. Next slide. We've made major strides in the area of engagement, outreach, and education, largely due to conversations here in this setting with you all. Having a robust prevention and health promotion frame is important now and will continue to be important for us in the coming months. Next slide. Again, here are some more of the community partners who have really helped to make our COVID response and our system what it is. Next slide. Many of you have been hearing about what's going on with COVID vaccine planning and when the vaccine is coming. The vaccine planning has begun here in Alameda County. Here's how essentially the process will work after the federal approval is finished, and the state has a phased approach that they're using to prioritize populations that will receive the vaccine at the local level. And we are then responsible for the storage of the vaccine and the equitable distribution of the allotment inside of the state guidelines. We're preparing here in Alameda County to receive our first batch of the Pfizer vaccine sometime in December. And the first priority groups that will receive the vaccine are healthcare workers in hospitals and skilled nursing settings and patients in skilled nursing facilities. Our Healthcare Services Agency COVID vaccine team will focus on 3 areas: a community advisory group, healthcare delivery system, and the immunization or mass vaccination logistics. Next slide. The vaccination is voluntary, and we really want to make sure through this entire process that we work closely with our community partners, with you all, to share information, be transparent, because we know this is new and we are all learning a lot every day about the vaccine or the multiple vaccines that are possibly on the horizon. And it's going to be important to get all of your feedback and to get the community's feedback. We also know that there's a lot of curiosity, but there's also a lot of skepticism around this vaccine. And it will be incumbent upon all of us collectively to provide as much information as possible and to be available that communities have. We hope that we're planning to stand up some sort of a stakeholder table made up of community leaders and residents, and to work within existing groups like this and others that we've been a part of along the way, so that we can ensure that the many voices that need to be part of this process and need to provide input into how vaccine will be accessible in Alameda County is possible. We know that good policy really is policy that is driven by the needs of the people and where the people who are most impacted are at the center. I want to close, as always, just reminding us that we are not out of the woods yet. And Dr. Moss has also stated this, that we still have a long way to go. And we just came out of a Thanksgiving holiday and are still feeling the impacts, and we still are looking for the impacts of that. And we want to just remind everyone that we would prefer, it is advisable to avoid gatherings. If you must gather, keep it short, keep it small, don't share food and drink, stay at home if you're sick or at risk, and if you must travel, use face coverings, distancing, and all the things that we've always talked about along the way. We are not out of the woods yet. We have a long way to go, and let's do our part to keep everyone safe. Thank you.
Thank you so much, Kimmy Watkins-Tart, our Public Health Director, and Dr. Nicholas Moss, our Health Officer for Alameda County. You two are amazing. I invited people to put questions in the chat. I just have one quick one. What are you seeing are the most common reasons people are contracting this? Is it gatherings? Is it work? Is it family members that are asymptomatic? Are we seeing a culprit for the recent increase in cases?
Dr. Moss, I think he's having a hard time unmuting.
Okay, and then another question from Jane Garcia. What's the best way as providers that we can prepare for the vaccine? You've got a lot of our great community health providers. How can they help prepare to distribute the vaccine?
Thank you, Jane, for that comment and that question. We are going to be creating a stakeholder group that we will be inviting our community partners to participate in. We recently have had some meetings with healthcare providers, and so we will be reaching out to all of our community partners, our healthcare provider partners, to make sure that we all have consistent information about the distribution process and the prioritization that's laid out by the state.
Great.
I think I'm at mute, Mayor, if you want me to answer the other question.
Please, go ahead.
So when there's so much COVID around, and there's a lot of COVID around, it's sometimes hard to pick out what the exposure was where somebody got sick. Was it the grocery store? Was it when they went to the park? Was it Thanksgiving dinner? Unless there's somebody that we know had COVID at that site. When people have when they know that they were exposed to somebody with COVID, they frequently report a gathering, often a friends or family gathering, that really emerges from the people who have a known contact. Sometimes people have known contacts at work. What's more often the case is we hear about people being exposed in break rooms and carpools and things like that. But we do see workplace outbreaks across a range of workplaces, often in situations where people have masks coming off. And then the other place that where we look at what may be driving transmission is our neighboring counties and really the published literature, often from CDC, but also from around the world, that really where people are able to do kind of more sophisticated analysis, points to these indoor settings where masks come off, where singing, shouting, eating, where that goes on. So we know those places are places where transmission happens really easily. And so all those sources of data are what we use to inform our understanding of the spread.
Great. And then there's also a question from Regina about how we are helping survivors of sexual trafficking and victims of sexual trafficking. We know that that is a particular health concern, especially in Oakland. And any comments on that?
What I would say is that it's really due to or with our partnerships with community-based organizations that specifically and are trained and well-suited to really provide services for victims of sexual violence and victims of trafficking. And so, Regina, we are looking forward to continued work with those in the community that are doing this really important work continue on as we go along in this process.
Great. And I also want to just commend you for walk-up testing sites. To our knowledge, the first walk-up testing site on International Boulevard, we have at least 3 that I can think of that are on International Boulevard in areas that do have, unfortunately, a lot of sexual exploitation going on. Another question from Jane Garcia. What happens when the testing grant dollars run out at the end of December? What then? Obviously, testing is key.
Yeah. Yes, testing is key. And we are working through different scenarios right now to ensure that our testing services can really hold up. And we're hoping that we will be able to maintain. We're still working through the details of that, though, Jane. Thank you for that question.
Great. Now, members of the public, you should be putting your questions in. We're going to go back to Q&A at the end of this. Please use Thought Exchange. And also, there is a survey. We have it also in Chinese and Spanish. So please complete the survey as we talk about some of our recommended next steps. I am so excited to move to the next part of our program. I have got to give a really special thank you to Eleanor Buchan. Eleanor serves as the Deputy Chief of Staff in my office. It is the busiest job in the entire city. I think it is in charge of all legislation, backs up the Chief of Staff, and in her free time, she has taken on playing a tremendous leadership role and has put in a huge amount of work for something that she did not originally sign up for when she took this job. So thank you, Eleanor. And then, of course, Rachel Richmond, who has been a long time staffer, particularly to Wilma Chan, and through the generosity of the Oakland Thrives Leadership Council, has been staffing the task force. These 2 ladies are going to talk about what is working. What have we learned based on your feedback? What are the actions that we believe we need to keep taking to do that rapid response to reduce disparities? And after we hear from them, we are going to hear from our fabulous partners at Bar High. Darius Young, who is the Impact Manager for African Americans and Pacific Islanders, and Will Dominy, Impact Manager for Housing Affordability and Equitable Development. Again, Bay Area Regional Health Inequities Initiative. We call it Bar High, and they are going to give you the presentation of our draft recommendations for action. And we want to hear your input. That is what this is about. This will not be as good as it needs to be without you, our experts, our community, weighing in on these presentations. So Eleanor and Rachel, over to you. Thank you.
Great. Thank you so much, May. I appreciate that. And if we could just show the next slide. Great. We learned a lot through the task force in the last 7 months, and just wanted to take a few moments to lift up what is working, particularly as we think through what our actions need to be moving forward. And through stakeholder interviews, really the most important thing that jumped out was to build on the existing assets in our community, particularly in our communities of color. Oakland and Alameda, like the rest of the country, faces significant racial disparities with the virus. However, we also benefit from a strong network of CBOs with long-standing relationships in the community. And that's really what helped us creatively tackle this crisis. Some of the components of building on assets that we wanted to highlight were first, proactive engagement. We saw organizations and local government really step up and pivot to proactively contact those who were not being reached through traditional methods. That may have been multilingual phone outreach from the Asian Health Services or food distribution from Tribe and Homies Empowerment, but we saw a lot of proactive outreach. Secondly, the importance of resourcing our smaller grassroots CBOs that are working in the community. Many were stretched to begin with and did not have additional funding to do street outreach to provide food and PPE. And as the crisis progressed, more resources were made available through CARES Act funding, through philanthropy, through other local government contracts, like the ones Kimmy Watson-Tart talked about. But this continues to be an issue that we need to think about moving forward. The third component of this is the importance of having supported spaces for collaboration. The pandemic really pushed government, healthcare providers, and CBOs to partner like never before. And we saw a number of innovative collaboratives like the Oakland Frontline Healers, who were able to bridge multiple organizations to connect folks to a wide range of resources.
Another thing that worked was continuously collecting, analyzing, and sharing data and information with impacted communities. Alameda County worked tirelessly to update their public-facing dashboard, which we just saw some screenshots of, and to use that data to target resources. That said, we need more disaggregated data, and we need to share it clearly and consistently with the community, as Roots did through their weekly broadcasts. The final thing that worked well was leveraging private and philanthropic resources to respond quickly. The magnitude of the pandemic was challenging for local government to respond to quickly. In the earliest part of the pandemic, organizations like World Central Kitchen and Centro Legal de la Raza and efforts like the COVID-19 Relief Fund were able to distribute emergency food, provide grants to undocumented workers, and set up testing for essential workers by raising private and philanthropic funds. We need to continue to find ways to quickly capitalize on private resources and figure out how to transition to more sustainable public dollars, which is something that Oakland Thrive's Leadership Council will consider. We'd like to show you a few short videos that highlight some of the innovative ways people came together to meet the pandemic.
Street Level Health Project is an Oakland-based community center dedicated to improving the well-being of underinsured, uninsured, and recently arrived immigrants in Alameda County. And so part of, our COVID response, really, we saw before shelter in place, the realities that our community, in particular, the Latino and Maya Mom community, was going to face during this hard time. Oakland is the home to over, I would say, 15,000 Maya Mom speakers, and we are home to the most Maya Mom speakers outside of Guatemala. We realized that in order to do this work, to reach the population to be able to encourage them to get tested and get the information needed and the resources if they do test positive, that we needed to work with one of the federally qualified health centers in our neighborhood, which was La Clínica de la Raza. And so we have been working with them for a very long time in terms of making sure to connect new recently arrived immigrants or those that have fallen out of care back into the system. And one of the biggest ways that, especially for the Maya mom community, they saw is the need of language, that they are trilingual, English, Spanish, and Mayan mom speaking. And so they were able to provide that service. And so we were able to build a COVID response team that comprised outreach workers, translators, and trained contact tracers and investigators to be part of La Clínica de la Raza's response team. We actually made big strides in the first 2 weeks of just having that contract with them. We were able to call 700 of our patients that had come through our doors to let them know about this new service that the La Clínica was providing in terms of testing in their neighborhood. And so many people were really grateful that they received this call to be able to know where there was a service now happening in their neighborhood and did not have to travel to other zip codes. And just also having the contact tracing and investigation offered in their language. It's been really important to have somebody that can speak their language and go through that process, especially a process that is scary to find out that you have tested positive and what comes next. We continue to provide food. I think that is one of the things that we're seeing over 100 people coming to our doors with food. And every week we're seeing new people arriving to our service. We're really grateful that we're in partnership with other organizations. I think this is one thing that as a pandemic, we've always partnered with many different organizations, but really we have, brought in many more partnerships due to knowing that this work is hard and it's not easy and we can't navigate this alone. So we're really thankful to the partnership that we have with Tribe, Homies Empowerment, East Oakland Collective, that we're able to just work and coordinate food services throughout the whole city because it's something that was needed. My hope is really that we continue to collaborate in these ways, whether the task force, continues or not, or what that may look like in the future, that we need to continue to have spaces where we're coming together as organizations, and in particular in the fruit mill, to be able to coordinate the response and also what comes next with the recovery.
USF had put together an initiative under the umbrella United in Health to focus on COVID testing in underserved populations, specifically in the Latinx and African American communities. Umoja Health, the name Umoja came from some of the community members who wanted some twist on United in Health. Our goal was to make sure that a high percent or high proportion of our resources went to the African American community. And then a secondary question was to understand if we were reaching people who had never been reached. That's where the pop-up idea came from, is to be specific and guided by community about where we pop up, so that we ensure that we meet the metric that we had set, which is to increase testing in the African American community. The thing that I guess I would really highlight and lift up is that the leadership are anchored by Black men. And I think that that's something that's super unique about what we were doing, because that's our efforts were not deliberately trying to reach Black men. It's just that the partners that we had, because they were led by Black men, allowed that to emerge. And I think what's important about that is that a number of the volunteers who stuck with us through, from the beginning, from the canceled one all the way to the end, were Black men who, what they had to say about what we were doing is this is some of the most impactful work that I've done ever in my life. And I think that the magic of Umoja is the ability to educate a community without being condescending or without approaching with a deficit lens, right? People became more aware in ways that I believe, based on the stories that they would tell me about their feelings about what they were doing, is that they're carrying that out to the community at large. And I think what was holding people together was to be in a space where there was something positive happening, that the people were doing it and the results were actually positive. Basically, people decided that they owned Umoja, right? And I was just providing, like, yeah, we have the test kits and all the stuff, and I'll bring all the stuff, but it's community who's going to then disseminate it, decide what it looks like, etc. So I think if going forward, I mean, if we wanted to do something really kind of revolutionary in Oakland, the thing to do would be to start to employ everybody in their respective neighborhoods against the virus. That kind of elevates this idea of like looking at community assets. Who do we have available to do the work that needs to be done, and then knitting that work together. That was the magic. I guess is the magic. That's why people, I think, keep coming back to Umoja, because they feel like they can make a contribution.
Yeah, I got involved with the Great Oakland Check-In, and Jack was the very first person who answered the phone. And Jack said, I could use some more food. And I said, well, what have you been eating? And he let me know that he was a 72-year-old blind man and that he'd been living on peanut butter sandwiches. Said, well, I can help with that. You know, I'm gonna get you signed up to get some meals delivered. And then we ended up chatting for about an hour.
And I was very limited on my food supplies, and so the Oakland reaching out to me was just the right help at the right time. Oakland is reaching out to the seniors and helping people that need help. I'm one of them, and I'm ever so thankful.
And so Oakland has found a way to leverage human relationships to build the kind of community strength to create defense and resiliency against COVID-19. So I just want to point out that this is not just feel-good stuff. This is based on very good science, and it's Oakland leading the nation and showing what a strong community can do to prevent COVID-19 from wreaking havoc amongst vulnerable people.
The Street Level Health Project.
Hello, I'm Darius Young from Bar High, and I'm the Impact Manager for African American and Pacific Islander communities, and I'll be providing you an overview of what the draft action plan looks like. So the purpose is to highlight opportunities to change policies, systems, and resources to further task force priorities. The approach is up to 10 immediate 12-month actions that are responsive to COVID, but that build toward the long-term transformative change we need to reverse racial inequities. And that includes city, county, state, and federal actions. So where did these actions come from? Well, they came from interviews with not only the task force members and affiliates, but also highlighting those who participated every week in the community outreach work group. Organizations like Global Communications, Frontline Healers, who were so instrumental in reaching out to those parts of the community that were hard to reach. Next slide, please. So our draft action plan structure, it features equitable care, social cohesion and racial equity, universal access to basic needs. Next slide. Federal funding for community-based care needs. What is this? Well, those things that fund community-based responses, including testing, PPE, quarantine, and isolation supports, culturally appropriate contracting, and multilingual education and outreach. Next, it entails new COVID package to fund community needs like racial equity, food and economic security, and housing. We are looking at an equitable care state package, bill package, and that will look at expanding health coverage to undocumented elders and eventually to everyone. And also state isolation and quarantine stipend. We also are looking at a state data disaggregation bill. This looks to improve the standardized data collection by public agencies and testing labs by race, ethnicity, and occupation. Next slide. So our social cohesion and racial equity. This is our racial equity contracting, and this engages with the ongoing efforts at the city and county to institutionalize those lessons learned from the Racial Diversity Task Force. And that looks at fast and flexible structures like vending pools to reduce barriers such as liability, bonding, reporting, high minimum contract size, and background checks that are so crucial to getting the work done fast and expediently and getting our small base organizations going quickly. And it also looks at guidance and scoring on culturally and linguistically appropriate services and emerging local businesses. And lastly, is support pass-throughs and support for smaller organizations. So our social cohesion and racial equity also includes our cross-sector community leadership. And this will continue to support dedicated self-organized community outreach and leadership. And this, we know when we talk about this, once again, it goes back to those organizations that were so instrumental in our community outreach work. And it would target also philanthropic giving to community leadership, plus collaboration. And which also looks at dedicated support for facilitation, communities, and convening, communications and convening, excuse me. And number 6 is volunteer coordination for social cohesion and resilience. And this will establish an ongoing volunteer coordination structure with the Oakland Mayor's Office to continue the work of the Great Oakland Check-In, which we just heard so many great things about, and how they reached so many people that were in need. Next slide. Next, we have our universal access to basic needs. And what does this entail? Well, it's guaranteed income. And the guaranteed income looks to sustain and expand existing programs. And it also looks at policy changes to bring guaranteed income to scale, such as state waiver for benefit interactions, and also to expand tax refund programs, such as child tax credit, and also to expand payments and eligibility and to remove asset caps and provide monthly payments. Next is the human needs and health priorities. And what does this do? Well, just one of the things that it looks to expand California's Medi-Cal system to include medically supported food and nutrition and housing stabilization and homeless prevention. And also it looks to expand the local medically supportive food programs and explore Imperial County's Wellness Fund model for investment in human needs like housing. Next slide. And also under our universal access to basic needs is our food security backbone infrastructure. And this looks at to develop countywide overreaching infrastructure to assist CBOs and food banks in applying for food for public funds and complying with reporting requirements and in accessing insurance and transportation, etc. And it also looks at our work with FEMA to clarify and amend guidance to allow purchases of trucks, warehouses, and other hard goods for food distribution. And then number 10 is our displacement for homeless prevention. And what does this do? It advocates for new federal funding, and it goes to prioritize displacement protection and debt reduction as eviction moratoria expires. Homeless prevention, and also keeping everyone housed that was housed during the pandemic. Next slide. And our universal access to basic needs, it also looks at state right to recall for workers. And what is this? It looks at to adopt statewide policy that provides workers laid off because of the pandemic with the right to be the first workers considered for rehire when employers are restaffing. And it's similar to our AB 3216 bill of 2020 and Oakland's adopted right to recall policy. And then it's our worker safety enforcement education. And that advocates for increased enforcement capacity at Cal Ocean and to create partnerships with CBOs for enforcement and education. Next slide.
Darius, does that conclude your presentation? Oh, Darius, you are muted.
I believe that does
All right.
conclude my portion of the presentation, and I will now hand it over to my colleague, Will.
Oh, great. Thank you.
No, actually, over to you, Mayor. Thanks, Darius.
Well, that was a great overview of our recommended priority actions. We want to hear from you. I know we already have some questions that have come in on Thought Exchange. So please, while staff starts putting up the questions we've gotten so far, you are encouraged to post more thoughts and questions through Thought Exchange. For our task force members, you can do it through the chat. And then please take the survey. Please take the survey. Everything posted, everything that we collect tonight, whether we talk about it or not, it will be incorporated into the final product. I do want to take this moment to recognize Melanie Moore, who is with us tonight. Melanie, maybe unmute yourself and say hello. Melanie is the interim CEO of the Oakland Thrives Leadership Council, a comprehensive collective impact effort that grew out of the Youth Ventures Joint Powers Authority with the city, the county, and the school district, but now bringing in the private sector, the philanthropic sector. Melanie, please talk about how Oakland Thrives is going to carry on this work.
Thank you, Mayor. Hi, everyone. My name is Melanie Moore. I'm the interim CEO of the Oakland Thrives Leadership Council, and really pleased to have arrived at this moment to accept the recommendations and the report from this Racial Disparities Task Force. As you'll see in the full version of the report, many of the next steps flow from the work of the task force, which was 6 months in duration, into the ongoing work of Oakland Thrives Leadership Council, which is a collective impact body that's the city, the county, the school district, and has connections also with our Peralta colleges and our First Five Alameda County organization. We have the capacity as Oakland Thrives to take on issues from housing to income to education to health to public safety. And we have experts at the table, including our own Dr. Eitan, Supervisor Wilma Chan, many of the people who are part of our leadership and also our community leadership in neighborhoods are part of Oakland Thrives. So as we go forward, we will be taking each of the recommendations in the report and helping to make sure that that work is continuing. We at Oakland Thrives may not do that work ourselves because it won't be within our purview, but we will be the ones who are helping to hold us collectively as the public sector accountable for continuing the work and implementing the recommendations. And in particular, we will house and support the community outreach group that you heard. So many of the recommendations you heard tonight have really derived from the work of that group. And I've had the great honor the last several weeks to get to meet those individuals and hear some about the work. and about the way moving forward that entity, that subgroup, will continue to meet and continue to develop ideas and feed them to us at Oakland Thrives.
Great. Thank you, Melanie, for taking this on so that while we made this commitment and this time period is over, we are so happy to hand the baton to you. And since I think 6 of the members of the task force are also in your leadership group, there'll be lots of continuity and continued activism. If you could bring up the questions from Thought Exchange, we can start asking people questions that have come up from the public. Could Darius's recommendations be shared? Can we post a link to that slide or to the entire report, draft report? I know the survey has some specifics in it, but let's post something. That's a great suggestion. How realistic is getting guaranteed income in place? I'll take a stab at that, and I don't know if Rob Bonta wants to weigh in also. I have committed as a founding member of Mayors for Guaranteed Income to do a major demonstration of guaranteed income during 2021. And so stay tuned. We will be having a demonstration in Oakland that will be implemented by the Family Independence Initiative, a fabulous national nonprofit that was founded right here in Oakland. As far as the path for a national guaranteed income, we probably think the next realistic policy implementation is an expansion of the earned income tax credit, particularly for young children. And that could be done at the state level before it gets taken on at the national level. But this coalition of mayors is national, it is active, it is on fire about getting this done. So know that there's an amazing coalition, national coalition behind this idea. I don't know if anyone else wants to add to the chances of guaranteed income becoming a policy reality. Hearing none, I'll move on, although people can also fold that into their closing comments. Is there any thought of completely shutting down for 1 to 2 weeks to curb this violence with proper information and prep for all citizens to stay home with pay? Dr. Moss, do you want to take that one on? Can you unmute yourself? This is relevant to the governor's announcement today. Dr. Moss or Kimmy Watkins-Tart, are you still with us? All right, well, I wait for you to possibly butt in. I will say what I know, which is the governor today announced that there will be a 3-week shutdown in any region where the ICU bed capacity falls below 15%. Oh, for some reason, Nick Moss cannot unmute. If one of the hosts can help him unmute.
There we go.
There you go. Thank you, Dr. Moss. This is your job, not mine.
Thanks, Mayor. I think you were doing a pretty good job of answering. Yes, the state has introduced a minimum 3 weeks shutdown. The threshold the state is using is down to ICU bed capacity in a region, not just one county, but a region. And there are 11 counties in our Bay Area region here. When that bed capacity gets down to 15%, so you only have 15% of your ICU, your critical care beds left, a more restrictive shutdown would apply. Not quite back to March, but more so than even where we are now with purple tier. I think that probably is not enough runway. I think the state probably should have been a little more aggressive. But we're going to look closely. It just came out today. We're going to look closely at it, be following closely what's going on here and what our neighbors are doing, because I think we can probably run into trouble before we hit that threshold. So,
Kimmy Watkins-Tart, can you maybe address the plans to provide financial support to the communities most impacted by COVID, Latinx and Blacks, so they don't have to work? Paying these communities so they do not have to work could save lives. Can you talk about what Alameda County is doing now and whether or not that's going to be extended?
So right now we are the county's ARCH stipend program, is set up to provide financial support to people who are testing positive for COVID. And so this is something that we offer to everyone if they're testing positive. We started in priority neighborhoods, and then we have expanded. We are looking to, working on plans to figure out how we can sustain many of our services beyond. And so I can't really answer that question right now about the sustainability of that particular program, but we do have it right now, and we are offering that to everyone who tests positive.
And do people find out about it when they are getting their test results, or is there more information through like 211?
It's both. So through our subcontractors who we have contracts with, many of them, all of them have information about the resources and supports that we have available. And so as part of the outreach that they're doing, they're also letting people know that if you test positive, please also ask about these services. In addition to that, when we do the case investigation and contact tracing, we ask everyone if they need financial support. And if they qualify and the barrier is very low, then we refer and they get the stipend.
That's great. There's a question on our chat from one of our affiliates, Julie Sinai from Lifelong Medical, for Assemblymember Bonta. Rob Bonta, is there discussion about extending unemployment for people out of work during the shutdown? Understanding the standstill at the federal level. But Rob, while you get ready to answer that, we did have encouraging news that just came out this afternoon that Democratic leadership is now supporting a bipartisan proposal. The dollar amount is less than we had hoped for. I think it's about $900 billion. That does sound like a lot of money, but it's not the original $1 trillion that the Democrats were asking for. It does not include direct payments to people, which is something that I know I'm very supportive of, direct cash payments, but it does support rent relief as well as an extra $300 addition for unemployment insurance. But Rob, what's going on at the state level with regard to supplemental unemployment insurance?
The state's role is always to be supportive of the people of California in the ways that they need that support, whatever that looks like, whether it be cash payments, unemployment assistance, tenant support, food, housing, etc. But we do think that the big guns financially need to come from the federal government, and that's its role. It has its ability. It can deficit spend. It can put together stimulus packages as it has. It should do that now. Whether it does it between now and inauguration or after inauguration of Biden-Harris is yet to be determined, but we'll support our people in that interim if necessary, is always our position. So we're hopeful, though, that we don't want to give the federal government a pass, but we do realize that gridlock is a fact of DC. So we'll step in if necessary.
Yeah. Thank you. I'm going to combine these questions. I think are for Kimmy Watkins-Tart or Dr. Moss. Will a new stay-at-home order disproportionately impact East Oakland residents? That's where cases are highest, but indoors is most dangerous. How will they stay home if they're the essential workers? And I noticed, I'll just add my own, and if they live in overcrowded residential conditions. And do you have anything to add to the highlights that we already showed with those great little videos about what we're doing to address the disparities that directly affect our Black and Latino communities?
So I'll start while Nick is, hopefully someone is helping him to get off mute. As we've seen throughout the pandemic, including the first shelter-in-place order, that the order itself does impact people disproportionately. And so at the beginning, when we all were told, when everything was shut down, work virtually, those who were able to work virtually were able to work virtually. Many people could not do that. And so they continued to leave their homes to go out and to work. And so we saw the impacts of that. And so, yes, any policies that we pass are going to hit hard those communities that are really struggling with housing security, financial security, food security. All those things are going to be compromised. So I have no reason to think that they would not be impacted disproportionately.
Kimmy, there was some talk about providing people safe spaces to quarantine in the hotels. Is that an availability or a possibility?
So those services do exist now. And we are working on a plan to continue those services to the degree possible over time. And so people who have tested positive for COVID, and when we are talking to them on the phone and reaching out to them, we are asking people if they're able to isolate and quarantine safely. And if they're not, then we ask them if they are interested in isolation housing. So that resource is available to people now.
Great. Please spread that word that cash support and isolation housing is available to people who test positive. We don't want anyone to be afraid of getting tested, and they should know that testing is an access point to these kinds of services. Dr. Moss, did you have something you want to add?
Yeah, just that I think that the overall risk to our essential workers is much greater if we have more COVID circulating in the community as we do now, and taking action to reduce the chance that those essential workers will encounter somebody else who has COVID, customer, member of the public, a coworker, is a really important part of protecting them. And shelter-in-place restrictions are a way to do that. I think the problem we ran into last time is we let them return to work first at a time when there were not adequate protections in place. This time they're already working, and so we're not asking them to go back to work. They're already working. There are better protections in place. Nonetheless, I share Kimmy's concerns that the impacts of the economic impacts are most certainly going to be felt more by these communities, and the risk, as long as there continues to be COVID circulating, is going to be felt most acutely in these same communities. And so, I don't want to, I don't want to take away from that. I think there are difficult futures either direction. But I think reducing the overall amount of COVID circulating does protect our essential workers.
Dr. Moss, don't mute yourself. I think the last two questions are ones that you can weigh in on as well. Maybe even the last three questions as we get ready to give our closing comments, because our time is coming to an end. But the question about the racial data on cases and access to testing in Black neighborhoods, it states that Black people in Alameda County have one of the lowest cases. This is a vast difference than nationwide. Are Black people going to get tested? And I do want to commend the members of this task force that I think have made a huge difference in both the Black community and the Latinx community getting tested. It's been an amazing community effort. Why did the disparities narrow in the last few months? And then a question about if they give vaccine to healthcare workers first, isn't that baked in disparity because overwhelming majority of healthcare workers are white? So those are some questions. Dr. Moss and Kimmy Watkins-Tart, if you could give your closing comments as well as address some of those last questions, I'd appreciate it. Thanks.
So first off, we have data on the race and ethnicity of people testing for roughly 40% when I last looked of testers. So not everybody gives that information. Some people aren't comfortable sharing. But for those that we do have this information, Black residents are testing at some of the highest rates overall. So we I think that is something that we can point to for the information that we do have, that there has been some success. And I know there's people in the task force, Dr. Rhodes in particular, who have really put a lot of effort into making sure that there's, we understand testing and that testing, access for testing in Black residents is available, and that we are doing it in a way that reaches them. Disparities narrowed in the last few months. Well, partly overall case rates went down, overall risk went down, even for people most at risk. And I think we saw a lot of amplification of our epidemic within crowded households. So if those people aren't bringing it home to the household, you're not seeing as much amplification in the household, which really contributed to those large disparities we saw at the last surge. I think the question is, what will happen this time around? And as I've said, I'm sort of holding my breath to see. It's a little bit early. And then I don't know, Kimmy, if you want to, there is an answer to the last one, but Kimmy, I don't know if you want to speak to it.
Yes.
I can.
Yeah. So this is where our work with community partners and the stakeholder group is going to be really critical, that we are at the local level responsible for ensuring inside of the state's prioritization to make sure that those healthcare workers or those that are in the priority group are getting the vaccine. And so it doesn't just include the direct medical providers, it also includes others who work in that setting, who are often Black and brown. In addition to the vaccine will be also available to employees that work in our skilled nursing facilities and congregate settings. Many of those settings are disproportionately employ people of color. And so we are going to be looking at that. And so that was a concern of many people, but we are going to be looking at that to make sure that we don't allow those baked in disparities to affect the distribution.
Great. Thank you. Please fill out the survey. If you have not filled it out, it's in the chat, it's in the stream. Please fill out this survey. We want to hear from you, especially on our proposed action plan. We're going to go a teeny bit over our 7:30 end time. We cannot end without having some closing comments. This is our final and last public hearing from our co-chairs. I can just say, as the mayor of Oakland, it has been a pure pleasure in this moment of despair and stress. You all have given me so much hope and so much pride in how this community comes together and just demonstrates fierce compassion every day in a way that I think is uniquely Oakland. As a mayor, I commit to continuing the Great Oakland Check-in as part of my commitment to our action plan. And then I will turn it over to our Assembly Member, Rob Bonta, then to our Supervisor, Wilma Chan, and of course, no one can bring us home like Dr. Tony Eiton. So please, Assembly Member.
Thank you, Mayor Schaaf. I just want to echo and share my thanks to all of you, incredible task force. And I want to start with our chairs, Oakland Mayor Schaaf, Supervisor Wilma Chan, Dr. Eiton. I think it's so important during this time of challenge and pain and struggle that our elected leaders with our shared constituents come together and join hands and fight for those who need us most. We always use that equity lens here in the East Bay, in Alameda County, and Oakland, making sure that top of mind are always the most vulnerable and the most disadvantaged, and those who need help first and most. And we've done that here, and I appreciate us doing what we've done, which is to share best practices, identify those approaches that made the most difference and transformed lives the most, but also realizing our work is ongoing. There's a durability, a sustainability, a longevity to this work, and that action going forward is required. And I commit to carrying the baton on some of the statewide efforts, a disaggregated data bill that will help provide the insight and information that we need to solve problems, making sure that we are breaking down larger groups into the subgroups as necessary to identify those unique experiences and guide the intervention and the policy proposals and action that we take. So that'll be very important. That's something that's been important to me before. It continues to be absolutely critical. We've seen that, and we've seen the need for uniform collection of disaggregated data across different public health agencies at the county level, at the state level, so that it can be shared. I'm also going to be continuing to work with Supervisor Chan in Alameda County on the food as medicine approach, making sure that for folks who are suffering from diabetes or hypertension, obesity, that the nutritious food and access to that really is what the body needs, improves health outcomes, and provides the support as necessary. There will be other other statewide bills being pushed, and I'm going to support those as well. But we need action at the state level, at the city level, at the county level, at the grassroots and community level to help our communities continue to be resilient and make it through these difficult times. So thank you for your partnership, for your leadership. Appreciate the opportunity to co-create solutions for our shared constituents together. Thank you.
Okay, I also want to thank my co-chairs, the mayor, Assemblyman Bonta, and Tony Eiton, for the opportunity to work together on this very difficult problem. I think when we look back on this time, this was really a sea change that none of us had ever seen or expected. And all of us had to change our behaviors individually and as organizations. I also want to thank the members of the task force. As the mayor pointed out, we have great leaders in Oakland. Every single one of you has contributed so much to the progress that we made so far. But as Dr. Moss said, we're still not out of the woods yet. I also, before I go on, I also want to recognize, besides Dr. Moss and Kimi, I want to recognize Colleen Chawla, who's not here today, and Lori Cox, who really led a lot of our efforts in putting together the Alameda County Connects with All In to focus on neighborhoods that had huge disparities, health disparities and income disparities. And I think to the extent that was successful, we were able to meet the equity index, and we should be very proud of that. However, I think that we're going to find we have to get through the next few months, and when we're done with that, there are going to be a lot of people who still need services. And so I'll be working a lot on the services that are still needed. I do want to emphasize that the CARES money, the big infusion of money from the federal government, was absolutely instrumental to doing this work. And without that, we are really going to have a problem. Alameda County, I think, received about $270 million that paid for the testing, paid for the PPE, the food. Food was a huge issue in the county. So we have to continue to lobby for that. And I'm very happy to hear that there's a bill, even if it's not the full amount, we really need that money. And that there were other areas that weren't touched on here that I've been working on, including the rent assistance. Those tenant ordinances run out pretty soon, and I'm really worried whether people are going to be able to make their rent. So I think that's really important. There's the whole childcare community. So there were a lot of other partners who participated, maybe not on these calls, but who are very instrumental to the quality of life and livelihood of our residents in Alameda County. I'm going to continue to focus on food. Food was just amazing. The number of people in our county who don't have basic food is shocking, absolutely shocking. When you have 1,000 cars lined up at the Coliseum to receive free food, and that's just one example in a state so rich, it's just shocking. And we need to continue to provide food, but not just food that helps deal with health disparities on the preventive end and make our citizens, particularly our people of color, more healthy, so that they won't have disproportional cases and die from things like the coronavirus. And lastly, I definitely want to work with Dr. Moss and Kimi on the vaccine issue. Dr. Moss told us this afternoon that in order for it to be truly effective, we need to vaccinate eventually about 70% of our population. And I asked him what the flu shot level is usually. He said about 50%. So that really shows you the amount of work we're going to have to do to keep our community safe. So we're going to have to do a lot of outreach, a lot of education, and make sure. Luckily, England's going first, so we'll get to see whether how the vaccine goes there, whether it's really safe. But that's going to be a lot of work over the next year, and it's going to be very important so that we can return to our new normal. So again, thank you to everyone, especially our smaller community-based organizations who stepped up at times when they were laying off people, when they didn't know they were going to be able to make it their rent for the next month. And we're just going to continue to work hard. This is a very, very resilient community that we should be very proud of.
I too want to thank my co-chairs, Assemblyman Bonta, Supervisor Chan, and of course the mayor. It feels strange to be actually ending this at this time, at the point when the virus is surging. We're just fresh out of a Thanksgiving, potentially super spreader event, heading into another holiday, which could compound all of that, and we're winding this down. So, I hope that is really not the sentiment. We've built something very unique and special here in Oakland and Alameda County. And this is the same infrastructure, human infrastructure, that we're going to need to respond with the vaccine campaign. We're going to have to leverage these very same resources to be able to effectively conduct a campaign. And the strength and effectiveness of our response, as we've seen, has been directly dependent on the strength of the relationships between the political leaders, the community-based organizations, the private actors, the philanthropic groups. That's all we have standing between us and really despair in this community. For those of you who know me, know that I like superhero movies, and I consider this group a group of super friends. I mean, people who have extraordinary powers, who are aligning those powers together to take on an unprecedented foe. So I hope we can continue to act in the spirit of superheroes and leverage the power that we have to essentially protect our community against this really incredibly insidious threat that has rendered virtually every one of our defense systems, almost to the point of helplessness. The only thing we have standing between ultimate loss is us and our relationship. So let's keep it going and let's be safe.
Thank you. Perfect words to end on. Let's be safe. These relationships are not going anywhere, and the superhero powers will vanquish the villain, COVID. It has been such an honor and privilege. This work is not over. It is transforming. It is evolving into a place where it can be more permanent with Oakland Thrives. Thank you for accepting that baton, Oakland Thrives. And everyone, please have a safe and as joyful as possible holiday. But please don't gather, like you heard that from the doctor. Please do not gather. And we shall get through this together. Thank you, everyone.